Welcome back to another presentation by the Sexperts. I'm Michaela, and today in our STI series, we are going to be discussing HIV. HIV stands for Human Immunodeficiency Virus, and it is a viral STI. This virus enters the body and damages the immune system, which protects the body against illnesses. Some of you may have heard of the term AIDS. However, HIV and AIDS are not the same thing. HIV is the virus that can cause AIDS. So how is HIV transmitted? There are 3 ways. First, you have unprotected vaginal, anal, or oral sex, and sharing needles or works or from mother to child either during delivery or through breastfeeding. Over the years, individuals with HIV have been stigmatized for their illness. It is not who you are, but what you do that puts you at risk for HIV. Those living with HIV can live very long, happy, healthy lives just like anyone else. The choices that you make to protect yourself will determine the outcome of your sexual and overall health. There are 5 main bodily fluids in which HIV is transmitted: blood, breast milk, vaginal secretions, rectal fluids, and semen. Other bodily fluids such as tears, saliva, sweat, or urine do not transmit HIV. HIV is also not transmitted by casual, day-to-day contact between people or through the air. It must get inside the body to infect a person. Although there are usually no symptoms, there can be a variety of symptoms to be aware of. Possible symptoms include fever, chills, rash, night sweats, muscle aches, sore throat, swollen lymph nodes, and mouth ulcers. So what happens when someone gets HIV? First, HIV attacks the body's defenses. After entering the body, the virus damages cells, which are T cells and other white blood cells that defend against infection. The virus can also multiply and infect organs throughout the body, disrupting other body systems. Let's discuss this a little further. At this point, there is no cure for HIV, and there are 3 possible stages of an HIV infection. Stage 1 is an acute HIV infection. Stage 2 is a chronic HIV infection. And then stage 3 can develop into AIDS. During an acute HIV infection, there is a large amount of HIV in the blood, and individuals are very contagious in this stage. This is where some people experience flu-like symptoms, often around 2 to 4 weeks after the infection. Some people may not feel sick right away or at all. People can live with HIV for years without getting sick. They may look and feel healthy and not even know they have the virus. A chronic HIV infection is also known as asymptomatic HIV infection or clinical latency. During this phase, some do not experience symptoms or get sick. In this stage, HIV is still active but reproduces at very low levels. And without HIV medication, this period may last 10 years or more. However, some may progress faster. This is also where the viral load increases and the CD4 cell count decreases. Symptoms may occur as the virus levels increase and the person moves into stage 3. However, people who take HIV medication may never move into stage 3. The final stage of an HIV infection is AIDS. This stands for Acquired Immune Deficiency Syndrome. This is the most severe stage of an HIV infection, where the immune system has become very weak and damaged. When this happens, other diseases and infections can enter the body, called opportunistic infections. This includes rare types of pneumonia, yeast infections, cancers, and brain infections. They are called opportunistic infections because they take advantage of the weakened immune system. People receive an AIDS diagnosis when their CD4 cell count drops below a certain level, or if they develop certain opportunistic infections. At this stage, people with AIDS have a high viral load, which is the amount of HIV in the blood, and can be very infectious. Without treatment, individuals with AIDS typically survive about 3 years. How can you get treated for HIV? Although there is no cure for HIV, antiretroviral treatments can be started while the person still feels healthy. One should start taking antiretroviral treatments as soon as possible after diagnosis. If treatment is delayed, HIV will continue to harm your immune system, putting you at higher risk for developing AIDS or even transmitting HIV to your sexual and injection partners. This is why early detection and early treatment is important. Antiretroviral treatments reduces the amount of HIV in the blood, or the viral load. If people with HIV remain in medical care and continue to take the medications to keep the low viral loads, they can live long, healthy lives. In addition, taking medicine will also help keep your CD4 cell count high. Most people can get the virus under control within 6 months. Medication can make the viral load so low that the test can't detect HIV in the body. This is called an undetectable viral load, which can be accomplished through taking medication consistently. Skipping medication can rapidly multiply HIV. Also, nutritional counseling can help make sure you're getting important nutrients to help possible side effects such as nausea and diarrhea. If untreated, serious long-term consequences can occur. Untreated HIV can become AIDS, which will then weaken the immune system and potentially cause a person to die from an opportunistic infection. So how can you best protect yourself? You're going to want to choose a barrier method that works for both you and your partner. Using a condom correctly every single time you have vaginal, anal, or oral sex can greatly reduce your risk of getting HIV. Here, you can use an external or internal condom or even a dental dam. Remember to never share any needles for any reason, and making sure you're taking HIV medication to prevent transmission. Now we're going to discuss how to get tested. Getting tested is the only way to know for sure if one has contracted HIV. If you think you may have been exposed to HIV, it's important to talk with a healthcare provider. They can help identify your symptoms as well as help set up an appointment to get tested. If you are in the Syracuse area, you can also call or text the CAP team at ACR Health, aka the Sexperts, at 315-415-6041 to set up an appointment to get tested for HIV as well as other STIs. The most common HIV test is either a blood or saliva test. These tests look for HIV antibodies, which are proteins that the body makes in response to a virus. There is a window period between when a person first gets tested for HIV and when an HIV test can begin to detect signs of the virus in the body. This can range from 2 weeks to 6 months long, depending on what type of test is done. During the window period, even before they know they are infected, people can still transmit HIV to others. Although there is no cure, PrEP and PEP are preventative medicines you can take to avoid contracting HIV. PrEP stands for pre-exposure prophylaxis. This can be used if you don't have HIV but are at risk. And PEP stands for post-exposure prophylaxis. This can be used if a condom breaks or if an individual experiences sexual assault. PEP must be taken within 72 hours after possible exposure. The sooner, the better. PEP is then taken daily for 28 days. For pregnant or breastfeeding mothers, the earlier HIV is diagnosed and treated, the more effectively HIV medicine will prevent transmission to your baby. Yet another example on why it's important to get tested. Giving HIV medicine to your baby 4 to 6 weeks after giving birth can reduce the risk of transmission to 1% or less. There hasn't been a baby born with HIV in New York State since 2016. If you have a partner with HIV and are considering getting pregnant, talk to your healthcare provider about PrEP. This will be taken while trying to get pregnant, during pregnancy, and while breastfeeding. Since breast milk is one of the 5 main bodily fluids that can transmit HIV, avoiding breastfeeding and using formula will help best protect your baby. So how common is HIV in the United States? In 2018, about 38,000 people received an HIV diagnosis. In 2019, there were 929 reported cases of HIV in Onondaga County. The annual number of new diagnoses decreased 7% from 2014 to 2018. By the end of 2018, there was an estimate of 1.2 million people in the U.S. living with HIV. 14%, or 1 in 7 individuals, didn't know they had HIV. So what about worldwide? There are about 37.9 million people living with HIV around the world. 24.5 million of them were receiving medication. The most affected region is sub-Saharan Africa, where 61% of all new HIV infections exist. To reiterate, what are the best ways to protect yourself? Being abstinent, using a latex condom or dental dam each and every time for vaginal, anal, or oral sex, never inject drugs or share needles for any reason, taking additional preventative measures such as using PrEP and PEP, and also making sure that you discuss HIV with your partner. To find more information on HIV, you can go to the CDC website. You can also contact the CAP Health educators, aka the Sexperts, for more questions, or try going to your local health center. If you have any questions, please comment below or contact us on social media. Please like and subscribe for more videos on sexual and reproductive health, and thank you for watching.